Okay, hi everyone. I am Muskan. I am GATE and NET qualified, and I have been tutoring students since last 3 years. And this is our third batch for research and statistics, where we will start off by doing the basics to advanced topics which are there in research, and we learn how to derive the degree of freedoms, how to calculate the degree of freedoms, the reasoning behind different statistic. We learn about basic topics as well, such as what is sampling, what is hypothesis, and this is all will be covered, which will be covered in today's class. And then we would move towards learning the different research designs which are there, different statistics, parametric statistics, non-parametric statistics which are there, and their applications in the research. So, yeah, today is our first class. So, I would like to begin by knowing you all a little and what is the level of research, like your knowledge of research and statistics. So, I think we can begin. Maybe Surya or Richa, you guys may introduce yourself a little in one or two line, and you may tell like where do you like what is the level of research that you think are on. You can categorize it into three terms. Maybe someone who is on a very newer level or who is very new to research. Second, maybe someone who has basic knowledge about research but wants to learn more, and third is the pro level. So, yeah, you guys may begin, and we would just do the introduction like for 2 minutes, and then we would begin with our class for today.
Hello everyone.
Hi, Surya.
Okay. So I'm Surya. I'm from Kerala and I'm doing my final year basic psychology. Hello.
Yes.
Am I audible?
Yes, you're audible. Your voice was getting a little distorted in the middle, but now you're clearly audible.
Okay. Mm. So I've done a research project as a part of my curriculum and I've completed it. So I'd say I have some basic knowledge about research and stuff. So yeah.
Okay, Surya, welcome to the class. Okay,
Thank you.
okay, Richa, may we know about you a little?
Hello everyone, my name is Richa Jaiswal and I have completed my bachelor's in psychology from Delhi University, and I have the basic knowledge of statistics as I've studied stats in my first year. I have the theoretical knowledge and I want to learn to calculate statistic fastly without the calculator because I think there is no calculator in the UGC NET exam. I guess yeah,
Yeah.
that's why. Yes. So that's it.
Okay. Thank you, Richa, for introducing yourself. During like on the last day of our course, we would also discuss what kind of questions which are there in net and how we can solve them. So yeah, that would also be covered. Okay, welcome to the class, Richa. Okay, can we have Fatima now?
Yeah, hello everyone. I'm in my final year of undergraduation BA psychology, and I'm not my curriculum doesn't give me the opportunity to do a research, but I'm more interested in research and statistics, and also I'm preparing for CUET PG, so I want to learn more about research and statistics.
Okay, Fatima, welcome to the class. I hope by the end of the class you will be able to gain more knowledge out of it and you will be able to do it. Okay, then, so we would be beginning with our today's class. So we are beginning with the very basic topics which are there. So today we'll be focusing on what is research, what are variable, different types of variables, different types of hypotheses, errors in hypothesis testing, and sampling at last. So this is what is the like syllabus for today's class. So beginning with research. What is research basically? If you look at the word itself, it says re and search, which means searching something again and again, right? So basically, when we want to make something a fact, if we want to prove something that it happens, we need to, like we need to validate or we need to experiment it again and again to prove it to be right. For example, one time what happened, someone who had high self-esteem was also shown to have higher level of success, right? But that might just be a coincidence. So what do? We research again and again. We research within or under different circumstances. We research on a large sample in order to generalize our results, right? In order to prove that or in order to create certain theories. So research is what? Research is a systematic, controlled, empirical and critical investigation of hypothetical proposition. How? It is a systematic, research needs to be systematic because there is a procedure that we follow. There are number of steps which are there that we follow. We learn about those steps in today's class. Then we conduct the research in controlled conditions as well. So, for example, I want to see, like you must have read about it when you would be studying maybe certain disorders or something. You must have read about certain maybe adoption studies or certain twin studies. So, what used to happen there? For example, there were two identical twins who were born at birth and later on they were put in different homes for their nurturance. Right? There are nurture and nature theories, there are nurture and nature experiments. So what have we done here? We have controlled the environment of the kids in order to get the exact result that we wanted to, or in order to prove the hypothetical statement that we proposed, in order to prove that okay, nurture might have an effect on the personality or on the intelligence level of the kid, right? Then it is empirical in nature, which means the research will give us or fetch us the results which are a result of a rigorous experiment or experience. So we need to prove whatever we do. We have done this. This is empirical in nature. There have been experiments which has been conducted. It has been experienced, observed, etc. Then it is a critical investigation. If you guys have read any of the research article, if you guys have seen any of the research, like if you have done your research, you must have seen that we also write the limitations at the end of our papers, right? And with that we also see what can be the limitation for a certain phenomena. For example, there are various researches which are being done on the critical investigation of certain maybe theories. Maybe there is psychoanalysis, so we also read about their criticism. So it can also be the critical investigation wherein we see the pros and cons of the research as well. And what is it done upon? It is done upon a hypothetical proposition or a hypothetical statement which states the relationship which is there within the environment, or which is a natural phenomena. Let us see an example here. Let me add a slide, please. Okay. Yes. So for example, there is a statement that there is an effect of nurture on IQ of kids, right? What it is? It is a hypothetical statement. Now we need to prove this hypothetical statement. So we will make a systematic stepwise structure. Like firstly we would establish our objective. We will learn about this systematic step in the next slide itself. Then we would create certain controlled conditions under which our experiment would be conducted. For example, we would create exclusion and inclusion criteria for our research, right? So for example, the exclusion criteria would be, I would only want to take up students who have no psychopathology, right? Or maybe those who have, like, whose parents have an average level of IQ, or maybe those parents who have a average level of income. I don't want to take very high class or very like middle class socio-economic status belonging people. So we create certain exclusion criteria and certain inclusion criteria as well, on the basis of which we control the settings or we control the sample that we are choosing. Then I would be creating a experiment which will make my research empirical in nature, and at last I would also be criticizing. For example, I would say, okay, the sample was very small, or maybe like there are few, or for example, if I'm seeing the efficacy of a psychotherapy, so I would also write about its pros and cons. And for example, if we talk about Freud's theory, there are a lot of criticism on the basis of it. Like for example, it was just conducted on women, and like most of the statements that he proposed were very derogatory, and his sample was also very very small, which was just the people that he used to see at his clinic, right? So we do all of that on what? On this particular hypothetical statement that needs to be proved, or which tells a relationship between a natural phenomena, that our nurturance, the way we are nurtured, the environment that we are in, it will have an impact on the IQ. So this is what a research is. Is it clear? If you guys have any query, you may ask. Okay. I believe that if you will have any query anywhere, you will type in the chat box, and you may also unmute yourself. So after maybe 1 or 2 slides, when we are done with a particular topic, we will wait for like 1-2 minutes for your questions, and then we would answer them and then move ahead, right? Okay, so there are various aims with what we conduct our researches. So the first aim, it could just be 1 aim or 2 aim, like it depends upon my idea, my interest, why I want to do that particular research, right? So first of all, explorative or formulative research. So explorative research basically wants to see, or basically wants to prove something new. It wants to add on some new insights to the research which is already present. For example, you want to explore the effect of like the socio or the psychosocial factors which have an impact on the IQ level, and it is a very new topic, so you want to add on to the knowledge of the already existing literature which is there, right? Then we do hypothetical testing. We just talked about an example of hypothetical testing. What is hypothesis? Like we will read about in detail about hypothesis, but we read about what is a main hypothetical proposition, or how does a statement looks like. So we may do our research for that purpose also. There are few research which are just descriptive in nature. For example, I am conducting a study on the literature of maybe John Olia. Okay? So I want to see like maybe what kind of people like to read his work, his writings. So herein I'm not doing anything. I'm not proving any relationship. I'm not proving any cause and effect relationship. I am just figuring out the features, the a characteristic of that particular sample that I am learning to. For example, I am conducting this one study of locus of control on male and female. So I want to see what is the characteristic feature of males in terms of locus of control, and what is the characteristic features of female in terms of locus of control. So it might tell me, or it might fetch me the results which will tell me the features or just the characteristic. They are not establishing any cause and effect. We are not saying that if a male is like male will have this external locus of control or internal locus of, we are not establishing a relationship. We are just trying to tell the features or the characteristic of the group, right? Then we have diagnostic researches. Diagnostic researches are basically or majorly done in the medical or clinical setup. So what is it for? While reading about a lot of like disorders, you must have seen few terms such as prevalence, incidence, prognosis. Have you read those terms? Have you come across those terms? Okay, yes, no. Okay, okay. So, what is it? It tells us about a particular number, or it tells us about the frequency of people, right, among which the disorder is found, right, or maybe prognosis, how much recovery like is possible, right? So what is being happening here, like for example, while the covid hit, so we were daily we were getting some number and some prevalence, like okay, now this many people are being affected by covid, this much are hospitalized and so on. So it is the diagnostic, it would come under diagnostic research. Then the factors which lead to a particular disorder would also come under diagnostic research. So any kind of research which adds on to the knowledge, or which adds on, or which helps in the diagnosis of a particular disorder or disease, would be categorized as a diagnostic research. So these are different aims with which we conduct our research, right? I hope it is clear. If there is any query anywhere, you may ask, and then we would begin by learning the steps which are there in research. Okay, okay. I assume that there is no query. Okay, so beginning with it, the very first step of conducting any research is to formulate a research problem. Now, what is a research problem? A research problem is more or less a interrogative statement which tells us about the relationship between two or more variables. For example, what is the impact of maybe personality on success? It is a research problem. It can also be like, for example, what is the impact of a particular program? For example, when national education policy was being released, so what was the impact of NEP on teachers or on students or something? It is a research problem, and we want to work on this research problem. It is different than that of hypothesis. It is a major generic wholesome problem which we are experiencing, right? So from where we can get this research problem? The research problem, the sources which are people. For example, impact of personality of people on success. It can also be due to some problem. For example, there are a lot of surveys which are being conducted. For example, the effect of maybe lack of amenities, or maybe the effect of bad sewage system, etc. We continuously see these kind of surveys there in newses as well, right? So maybe we can derive a research problem from a problem which is existing in people. For example, there are anxiety disorders, there are different disorders. We can also research on that. We can actually formulate our research problem from that. Then there are various programs which are there, like for example national education policy, or for example even before implementing any kind of research, or even when we are doing some kind of a like implementation on a very large scale, then we do a pilot study, right? Like in technical or in scientific terms we call it a pilot study. Or maybe like there are times when the government also conducts a lot of surveys which are there, right? So for example, like before implementing a very large scale, or before investing a lot of money in a particular like program, they do a particular survey or a basic baseline survey where they will maybe do it on a very small sample, so that they get an idea of its impact or what is it. Then at last, on the phenomena, there are a lot of maybe PTSD based researches. There are a lot of like researches which have been done on various phenomena which are there, right? And there have been derivation of various phenomena. You must have read about those. For example, minimum justification effect. For example, maybe noumenon, phenomenon, etc. So it is a natural phenomena which is there, which occurs, right? And it is on the basic program structure, the problems which faced by people and the people itself. After formulating a research problem, what do? We move ahead to lay down the objective of our study. Now, this problem, if you will see, they are very generic. They are not talking about a particular, maybe, variable. They are giving a very wholesome or a very generic viewpoint of the, the problem which is there that we want to see. But while conducting research, we need to set up or we need to choose some specific variables which are there if we are conducting an empirical study. So what do? We set up a objective which is derived from the research problem itself, right? So the objective, herein I am writing the example of objective. So an objective would start off with something like that: to establish the relationship, to explore the relationship. So a research problem is an interrogative statement, but an objective is written in such a manner, right? And there are times when the objective of the research are made after doing a review of literature also. For example, I want to research upon maybe sense of achievement. So I will read about the researches, the literature which is already present. I'll read different books, different research papers published by people, which will help me in recognizing the variables that I want to study. For example, I read maybe 10 or 15 different studies, and in those studies it was written that sense of achievement is related a lot with maybe attachment anxiety or childhood trauma or something of that sort. So it will give me an insight into what is the research problem dealing with, right? For example, let's start with a research problem. Let me add a new page, please. Okay, so let's start with a research problem. So a research problem would be like कि for example आजकल like nowadays people say that why are Gen Z so sensitive, why are they suffering, like why are they all about like mental health disorders and everything. In our time it does not used to be that. Okay, so let's take this very generic problem, right? So why Gen Zs are more sensitive. Okay. It is just a research problem. It is not talking about the specific variables that we want to take. It is not talking about a specific problem as such that we want to partake, right? So now I would read on to the existing literature, maybe, if I'm not able to figure out the variables. Okay, so I would review the existing literature. So maybe we can say that ki information exposure is there. People know about the information. We are the internet generation. We know about all the stuff. We want to learn about all the stuff because of which there is cognitive overload as well. This is just an example, right? Like I'm not saying कि यही इसीलिए, no. So there might also be like now people are maybe they are realizing about the generational trauma and they want to break out of it, right? So there were number of variables that I found in the existing research which was already done by other people, right? Then I would pick and choose my own variables, okay, which would help me in focusing the objective of my study, right? Now I cannot just vaguely say I want to see why are Gen Z sensitive. It would be a maybe descriptive research or exploratory research then, right? But it would not be an empirical result because I will not be able to create a whole experiment out of it, or maybe there would not be any such question like that. We'll read about different research methods in our later classes, not today. So for example, maybe if I want to do a research like that, so maybe I'll just switch to case study methods or maybe a basic open-ended survey kind of a method, right? Wherein there is no specific answer. But if I want to do a study which is empirical in nature, so or maybe like if you have come across various questionnaires, inventories or psychological assessments which are there to begin with, we need to formulate, or we need to come across, or we need to finalize few variables that I want to study, right? So let us take like maybe few variables from the literature that we found. So I would be like to explore the effect of information exposure on level of maybe negative emotion experienced by people, or maybe Gen Z. Now it is talking about a specific variable, it is talking about a specific terms which are there that I can conduct a empirical or a experimentation on, right? So this is done. After that, I have finalized my objective, I have finalized what I want to study. Then it is also major, like for example this was a huge subset. Now I have finalized or specified few variables, or maybe I finalized few specific parts of the problem. Then I would review the literature again, right? So for example, now totally exploring the relationship between the information exposure and the negative emotion experienced by people, or maybe the level of sensitivity, and maybe the frequency of like by which they are suffering from depression, right? Anything which is of the researcher's interest. So after that, I would develop a specific hypothesis. Now we come on to the main term which is there. So this was our problem. Then we established our objective, which was very very specific, and now from the objective we will come upon a hypothetical statement that will be finally tested. So let us first read about what is variables, what are different types of variables, and then we would come to hypotheses which are there. So till now, if anybody has any problem, you may ask, and then we would begin by learning our like variable and hypothesis which are there. Okay. Okay, any query? If you have understood, or if there is no query, then you may send a thumbs up or something like that. Okay, everyone. So let us read about what is variable. So as the name suggests, variable, something which varies, something which keeps on changing, something which is different from one individual to the other individual, and they can be measured also. So for example, in psychology, or whatever you have learned till now, maybe in your 12th standard, in your bachelor's or your master's, you must have come across different variables or different hypothetical or psychological constructs which are there, such as intelligence, such as maybe extroversion. Okay, wait. To explore the effect of let me see the message. To explore the effect of loneliness and coping on depression. Is this okay? Yes, it's fine. It is an objective. You have specified two main like independent variable, and depression is the dependent variable. We'll learn about that, and then we would formulate our own hypothesis also, but then whatever you have written is also fine. So okay, so beginning with it, so you must have read about, or you must have come across different terminologies of psychological construct which are there. So maybe intelligence, extraversion, psychoticism, neuroticism, etc. They are all measurable, right? There are a lot of different psychological assessments which are there. Okay, so all of them are explanatory in nature. We can explain what is intelligence, we can tell what is extroversion, what is introversion, what is psychoticism, etc., and we can measure them all also. So it is the variable. So a variable would be something which varies, something which can be measured, something which can be explained. Right now, most of these psychological variables cannot be directly observed. For example, temperature is also a variable. Temperature also keeps on changing. Temperature can also be measured with a thermometer, right? But the psychological variables are not like that. They are not directly observable. So we have created a lot of different psychological assessments, different testing to measure those, right? So there are different types of variables as well. We have independent variable, dependent variable, and extraneous variable, right? So firstly I will begin by telling an example. So let us take the example which was given by Sumit only. So to explore the effect of coping on depression. Okay, so let us begin by understanding what is independent variable. So independent variable is something which will impact the other variable or the dependent variable that we have chosen. So herein we are trying to, in this example, we are trying to see what is the impact or what is the effect of coping on the depression level experienced by person. So independent variable has an impact on or has an effect on the dependent variable. Then independent variable is something that can be manipulated, measured, or selected. Let us understand what it is. For example, here in coping, obviously we would be able to measure coping, like the level of coping. For example, like there are different tests which are based on PTGs, etc. Right? For example, there are different studies also. For example, I want to see the effect of gender on depression. So gender is a variable which can be selected, which can be segregated into male and female. There are other studies also which see the which explore the effect of a particular medicine on depression. Now the medicine that we are giving, we can manipulate the amount of the medicine that we are giving. Maybe to someone I would just give a 15 milligram like tablet, to someone I would give a 30 milligram, to someone I would just give a 45 milligram. I can manipulate the level of independent variable also. So this variable is further on segregated into two different types of variables. Let me add a new slide. So independent variable, we know independent variable will affect our dependent variable, but it can be of two types. It can be a type S variable, which is just selected, which we cannot manipulate. Okay? Such as gender, we have just selected the gender, we cannot manipulate the gender of people. Then we have type E variables, which can be manipulated. Okay? For example, the amount of medicine we are giving to someone. Then these variables, these independent variables are also known as stimulus variable, because it would elicit the change in the dependent variable. So independent variable will elicit the change. That is how it is impacting the DV. So for example, if I am giving a tablet of 50 milligram to a depression patient and 30 milligram to a depression patient, and then 45 milligram to a depression patient, it would have different impact on the level of depression experienced or whatever we are measuring on the person. So it is known as stimulus variable or change variable, because it brings out the change. And at last, it is categorical in nature or it is nominal. Categorical, such as कि we were able to differentiate or we were able to categorize themselves in different categories, such as male, female, etc., or such as like maybe low dose, medium dose, high dose, etc. And there are times when it is just for the namesake, it is just nominal, we are not categorizing it at all. Just for example, effect of coping on depression. So we have learnt about different characteristic of our independent variable as written here. It can be manipulated, measured. The main point is this, that it will have an effect on dv, then it can be manipulated, measured and selected, and on this basis we have segregated them later into type E or type S variable. Type E are the variable which can be manipulated, type S are the variables which are just selected, we cannot manipulate, and later on it can be categorical in nature or it can just be nominal, which means it is just for the namesake. Right? Is this concept clear to you all? If you have any query in it, you may ask. If you have understood, like when I ask, if you have understood, you may just like send a thumbs up or something like that. I would know. Okay everyone, thank you. So now we have dependent variable. What is a dependent variable? A dependent variable is something which gets affected, something that is of interest to us. Something which is of interest to us. In the beginning, if we take this particular example, we just wanted to see how depression is getting impacted by coping. We can change this IVO anytime, maybe to maybe level of loneliness experienced by the person, the level of social support which is there in a person's life, right? So it is the main or like the main variable which we are interested in, and it is the variable about which we make the prediction. Then we are observing it, we are recording it, the level how depression is getting affected. So for example, in this particular example that we took, we were seeing how we were observing how depression was getting affected with the increasing amount of medicine which was, or the increasing amount of dose which was given to the people, right? And it is also known as response or behavioral variable, because it is a outcome based variable. It is something which would respond, it is something which would create an impact. For example, I want to see the effect of violence showcased by parents on children. Okay, so what will happen here? We will see, for example, I have categorized it into two groups: parents who have like very low aggression level, parents who have a moderate aggression level or maybe show very mild violence, and parents who are very very aggressive and they show a lot of violence. So now I will see how their child is responding to that, what are the behavioral outcome to that, right? That's why it is our DV, our dependent variable, is a response or behavioral based output or output based variable, right? And it would always be continuous in nature, right? Continuous is something which can be measured or which can be expressed in terms of decimals also, right? So this is about our independent and dependent variable. If you have any query in it, you may ask, and then we would move towards extraneous variable. You may give me a thumbs up if you have understood. Okay. So Now, moving towards extraneous variable. Let me add another slide, please. For example, I wanted to do a research which was like looking at the impact of coping on depression. But we know that not only, like, there are other variables also which may impact depression. Maybe the level of social support, maybe loneliness, maybe some trauma experienced by the person, right? So all the variables which are not a part of research, not a part of the research or not the part of objective that we undertook, are our extraneous variable or the extra variable which will have an impact on our DV, but they are of no interest, right? But it will have the potential to offset the result of our research altogether. For example, I am looking at the impact of coping on depressive patients, and I have taken 10 people as my sample. So the first one has very, low social support, second one also has very low social support, like so on and so forth. So out of it, like on an average, 7 people had very low social support, right? And the results that I'm getting is that the depression is not getting cured even when they are indulging in different coping strategies. They are not, like, their depression is not healing at all. But herein, what is of interest to us? The people were not depressed because these coping strategies were not working. People were depressed because they had no social support whatsoever. Right, so this extraneous variable, this variable which was not a part of my study, still impacted the result of my study. These variables are extraneous variables, right? So any other variable than the selected IV or DV which has the potential to affect the dependent variable, that is our extraneous variable. So what do we do in a research like this? Because, okay, let me put a heading also. So it was for extraneous. Yeah. Okay. So what do we do in a situation like this? We try to control the variables. Earlier, when we began the class, we read about controlled settings, right? Wherein I was talking about there are inclusion criteria, exclusion criteria. So maybe I can create an inclusion and exclusion criteria here also. Maybe I will check the level of social support in the people itself in the beginning, and I will take all the people who have maybe moderate level of social support or high level of social support for my research, so that I can definitely see the impact of coping on depression, coping strategies that I am undertaking on depression, right? So they can be controlled. There are various techniques by which they can be controlled. We will learn about them in later classes, right? And the extraneous variables are of two types further on, right, which is dependent upon how they impact our study. They can be confounding in nature or they can be intervening in nature, and now we will read about that. So what is a intervening? They are both type of extraneous variables. Okay, let us see how. Intervening variable would be the variable which would explain our study. For example, if you have done or if you have written a research report in your bachelor's or your master's program, you must have seen that while you are writing the discussion part, you always write why you have gotten the results you have gotten, right? So what do? Then we add on different variables, such as we say maybe it is because of the age range that they belong to or the gender of the participants, etc. And these are the variables which were not the part of the study initially, but they help in explaining why we got the results that we got. Let us see an example. It is for intervening. Yeah. So, for example, I want to see the level of the impact of caffeine on anxiety. ठीक है? So for example, caffeine will make the person stay awake for later, or it will lead to sleeplessness. I don't know what I was writing. Let me change it. Yeah, it may lead to sleeplessness, which would further on maybe which would further on create a sense of anxiety, or which would maybe keep them awake all night, and then they would indulge in overthinking and so on and so forth. So herein, this sleeplessness was explaining why we got such a result in our study. It was not intervening the the study itself. Such as, so what will happen? This caffeine caused sleeplessness, which further on caused anxiety late experienced by the individual, right? So the exposure variable, the main independent variable which was there, and this is the main dependent variable. This is the extraneous variable which acted as a mediator or an intervening extraneous variable. Is it understandable? If yes, then we would understand confounding variable. Okay. Should I use another example?
Yes.
Okay. Okay, so let me add another slide, please. So, for example, the objective of my study was to explore the effect of poverty on low IQ. Okay? So, if someone is poor, maybe they will not be able to, so there would be a lack of amenities. Maybe they will not be able to afford tuitions whatsoever. They will not be able to go to good school. Maybe their parents are not that well read, which would lead to lack of nurturance. The nurture is not there at all, which may impact their IQ level. So herein, the poverty is explaining that they did not had any kind of amenities, कि वो tuition afford नहीं कर पा रहे थे, they were not able to go to a good school, etc., which further on led to low IQ, right? So herein, this lack of amenities, no tuitions, or no extra help, or maybe uneducated parents did not interfered with the result of our study. It explained why we got such a result, right? In the initial example that we undertook, this social support was interfering with our study. If the social support was there, our study was getting distorted. Like, for example, we were not able to explain why coping strategies were not impacting the depression, because social support was interfering in the middle, right? It was not explaining our study. So herein, it is explaining our study. It is also, these are all extraneous variable, but they are just explaining our study. They are not disrupting our study. They are explaining our study, and we can further on use these variables in the discussion section of our report writing also, to explain how the variable impacts, how the IV impacts upon DV. Is it understandable now? Okay then. So moving ahead, now we have confounding variable. Confounding variable would be a variable which would just confound the study, which would disrupt the impact of the study, right? So for example, the here in what example that we undertook initially, let me add another slide. Okay, so we were seeing the impact of various coping strategies on depression, and I undertook the sample which had very low social support, for example. So here in coping strategy might get affected, or the depression will also get affected because of the coping strategy, but coping strategy are not causing this, and this is causing this. For example, okay, I complicated it a little, sorry, wait. For example, I am maybe teaching the clients which are there the some skill training I am undertaking. So I am seeing that there is no impact of those skills on depression whatsoever. For example, I am teaching them how to maintain themselves, or maybe some social level of support, how to undertake that support, how to make good use of that support, and how it will lead to the betterment of the depression. But it is not having an impact on the depression, or my study is not getting like I am not fetching the results that I initially aimed to. So what I did, so later on I found out that social support was the main factor which was disrupting my study. How? This people, they do not have a social support in the beginning. For example, they had no people to use those skills with, right? So how will their depression be treated? So in the intervening extraneous variable, the IV was causing the impact of extraneous variable, which was further on leading to the cause or effect on the DV. Herein IV is not impacting EV, but EV is impacting our DV, and IV would also be impacting our DV. So you can also see it in this particular diagram. Our independent variable is getting affected by the confounding variable or the extraneous variable which was there, and which is further on leading to discourse, and we are not able to explain this relationship initially. This is how it works. So we have two types of extraneous variables. We have intervening variables and we have confounding variables. Okay, if that's clear, okay, I can see a message. How can I identify that XYZ is the confounding variable out of so many extraneous variables? Okay, so what happens most of the times, people just don't they do not really worry about it, they just skip it, they just say that okay, it did not have any impact. But if I am pursuing, or if I am doing a study on a very large scale people, for example on 400 500 people, I have invested the time of money, I have invested time, money, etc. So I cannot just let go of the study just like that. And we know that this is a very good structure and it has worked with maybe other population, right? So what do? We undertake some measures. We try to we can also read on to the existing variable which is there, or maybe we can see that, then we can use maybe some open-ended survey to see okay, what is happening exactly. And there are few measures which allow us to offset the results of confounding variables also, or to include the confounding variables later in our study also. For example, there is NCOVA. We will read them in the later classes when we will be reading parametric and non-parametric statistics, but there are measures by which we can include those confounding variable as a part of the study and still publish or still make use of the study that we undertook. Right, and also yes, it is very difficult to identify the confounding variables which are there, and there are various confounding variables which will impact the study on different levels, and we cannot let go of all the confounding variables which are there. So we try to control the settings. For example, there are settings which there are experiments which are undertaken in a laboratory kind of a setup, So there would be a high manipulation of the IV hair, right? Or maybe we will keep them in a particular kind of setting only. For example, if I want to see the effect of some medication on depression, so whatever I feel might be the possible confounding variables, such as sleep, such as nutrient, etc., I will try to control those confounding variables, the major confounding variable that I would feel. So maybe I will track the amount of sleep that the person is getting who is taking the medication, or we are providing them with a specific nutritional diet itself, in order to control these settings, in order to, you know, like generalize or normalize all these settings for the people, and then only see the results of the or the effect of medicine on depression, this particular medicine on depression. Yeah, I hope I was able to answer your question. So this was about the various variables that we have. If any one of you have any query in whatsoever we have done till now, you may ask, and then we will take a 5-minute break because it has already been an hour. Go roam around, have some water, and then we would come back and read about different types of hypotheses, errors in hypothesis, etc. Right? So if you have any query, you may ask. Otherwise, we'll take a 5-8 minute break and then we would begin again.
Can you please summarize the confounding variable again?
Okay. Wait, let me change the slide. Okay. So confounding variable is a type of extraneous variable, the variable which was not the part of my study from the beginning, and it is disrupting the result of the study that I want to undertake. For example, if we see, let me add another slide. I will try to write in a better manner. Okay, so I want to see the effect of medicine X on anxiety. So I want to see medicine X ka cause on anxiety. This is our IV, this is our DV. So I am using I am doing this study on a sample of 100 people. Okay. So I have conducted this study and I found out there was no impact on the anxiety, for example, or the medicine was not treating anxiety whatsoever. So there are few variables which might have affected it. For example, maybe 80 out of these 100 people were not getting enough sleep. So what is happening? Sleep is leading to anxiety, and it is disrupting the result of my study. It can also be other way around. For example, there is some medicine, or like for example anxiety is there. Okay. So this, like for example, the person is doing yoga. So this medicine is not having any impact on the level of anxiety experienced by the person, but yoga is impacting the anxiety in a better manner, right? But yoga was not a part of our study, neither was sleep a part of our study. They have disrupted the result of the study. Maybe herein I will say that okay, this medicine has a good impact on anxiety, but it would be wrong. The medicine is not having any impact on anxiety whatsoever. Yoga is having the actual impact on anxiety. So here in this, yoga is our confounding variable which disrupted the result of the study. Okay.
Means we cannot rely on any research. Like, not every research is very true because of
Yeah,
these confounding or extraneous variable.
yeah, but
And there
then
is no way to overcome it, or are there any?
yeah, there are different ways. like that we can use to control the level of this confounding variables, such as like as Sumit asked. So for example, we think that sleep, nutrient, or maybe any kind of yoga and all can impact our study. वो पहले ही स्टार्टिंग में ही रिसर्चर मेक श्योर, रिसर्चर विल नो. फॉर एग्जाम्पल, दिस रिसर्चर हैज़ read a lot of literature which was already there, so they must have come across the study which see the level impact of sleep on depression, nutrient on depression, or whatsoever, I mean whatsoever, right? So the person will already have an idea that what can possibly impact their study as a whole, at a whole level. There are also some variable which might be impacting and the researcher has no idea about it, right? We will read about it later also. So what do people do? We try to control the settings, we try to manipulate the settings. For example, the laboratory, the studies which are partaken in a laboratory settings, they will have a higher result, but still they are not in a normal setup. For example, the person will just go back to their home and do whatsoever, the medicine will not have an impact then, right? So we try to control them. There are also other type of methods such as counterbalancing, etc. We will read about them very later in our classes, like in maybe on third or fourth day. But this is just an introductory basic classes that we just want you to be accustomed with these terms, which would come on later in different research designs, etc. Right? So there are methods and there are statistics also. So for example, okay, let me add one more example to this list. Okay, so for example, there is a researcher who wanted to see the effect of no, okay, let us not take the example of a variable that we have studied earlier. Okay, so there is a researcher who want to see the effect of education on personality of people. Very lame example it is, but still okay. So the person is trying to, they have maybe used some assessment which measures the quality of education provided to the student and the different personality variables such as maybe emotional management, etc. Okay, so we are studying the impact of quality of education on emotional management. Okay, then later on there might be few confounding variables that we did not control initially. For example, the researcher tries to control whatsoever confounding variable that they feel is there, but there are times then they miss out on this. For example, socio-economic status, the person was not aware about this at all. They thought initially that okay, we are taking sample from a particular school, so most of the people who would be coming to this school will be belonging to a particular socio-economic status. So this has a lot of impact on emotional management, for example, hypothetically, right? So this socio-economic status has confounded, maybe has caused to maybe low emotional management, not the quality of education directly, right? So there are different types. For example, I was talking about this one statistics, for example, ANCOVA. तो पहले initially I did this study on this, ठीक है, and later on I found out okay, this because of this I am not able to fetch good results, or the results that I was maybe partaking, या फिर the results are not correct, ठीक है. So that is when I would include the study in ANCOVA. So ANCOVA allows us to add on a confounding variable at a later stage of the study, ठीक है. So then what I will do, मैंने data collect कर लिया था on the quality of education and on the emotional management done by the student. Then I would collect the data of the socio-economic status that the person belongs to, ठीक है. And then I would add on this particular variable as a moderator. Okay, this quality of education has an impact on emotional management, but the socio-economic status can moderate or it can affect its relationship. ठीक है? So this is one method when we can save our study. There is counterbalancing. There are certain methods. For example, I would take 4 groups. You must have also read about such experiments in your maybe graduation where they use 4-5 research groups. For example, one research group will be given no medicine, one will be given 1 tablet a day, one will be given 2 tablet a day, one will be given 3 tablet a day. ठीक है? And there are also studies which are based on latent square, which are there. Abhi I was not actually including all this because this is a lot and you will learn about all this at later stages. So there is mixture of all of the things which can help in offsetting the confounding variables which are of high importance. It can be done, right? So yeah, we have done quite a good discussion on extraneous variable though. If still anyone has any query, you may ask and then we would take our break. Okay. Thank you so much. So we will begin our class again on 8. Should we meet again on 8? Is it fine with everyone? Okay, then take a 10-minute break, go have water, have maybe a quick bite, something, and then we would read about the hypothesis and all.